Thank you, Satyan sir, for inviting me and allowing me to contribute for this instruction course. So thank you. So my talk is how to deliver cost-effective, high-quality patient practice, dollars and sites in photography. So this article was quoted by P. Satyan sir also about the fundus examination by 90D versus fundus photograph. So image-assisted fundus examination may enhance detection of retinal lesions compared to traditional fundus examination alone. Now, timely detection and treatment of ocular disease can lower the risk of vision loss and reduce the healthcare costs, particularly for those with diabetes and those at the risk of age-related macular degeneration and glaucoma, because these are the conditions which we can pick up very well if we have the routine fundus photograph in our routine protocols. Retinal imaging has been extensively used for the photo documentation for the clinical purposes as well as research, telemedicine, and the patient education is also a very important thing. When we counsel to the patient about any pathology, whether it is a BRVO, whether it's a single RNFL defect with disc hemorrhage seen, something becomes so easy to counsel to the patient during the busy OPD. This is what the disease is and this is how. So it becomes very easy for patient to understand also. So apart from all the things like photo documentation, the research and telemedicine, I see is a big benefit in patient education and the counseling, where we can discuss the patient manager, discuss the management plan very well with the patients, and that becomes very handy. So some of the studies have demonstrated fundus photography is superior to dilated fundus examination, particularly for detection of subtle retinal lesions such as microaneurysms, very early microaneurysms, small retinal hemorrhages, neovascularization at the disc or elsewhere. And this kind of early diagnosis of diabetic retinopathy is where then we can again make the difference by asking them to have again a tighter control of diabetes. So detecting things in a time and the lead time that this provides, that really works in patient's favor. So that's why the routine fundus photography should be the important thing for all the busy practitioner and especially the private practitioner. Now, fundus photography technology also has evolved over a period of time, where initially most digital photographs used to be only of 30 to 45 degrees, but now we have up to 200 degrees wider photographs also available, where we can examine the mid-periphery and up to the periphery also. And the non-mediatic one, which has now been the reliable screening, and that is a time saving also, as sir has clearly pointed in his presentation, that dilatation and again patient waiting in the busy COVID time, again you calling them for examination and photographs. So recent non-mediatic ones, they are the best one because they save the time for you and for the patients also, and no need then again the discomfort of 2 hours because of dilatations. And these are the various lesions which are subtly picked up by the fundus photograph, which can be very easily missed on the clinical examinations. And of that are the suspicious cupping or some thin retinal nerve fiber layer defects, some staphylomas, posterior pole macular pathologies like drusense, RP changes, some small hemorrhages in the periphery, some scars, choroidal nevus, peripheral retinal degenerations or hemorrhages, retinal holes, some vitreoretinal interface abnormalities. So these are the common things which can be very easily missed in our clinical practice, which fundus photographs gives us a diagnosis. They document that, and with that we can follow them future, because some of these things can worsen over a period of time and can become then the clinical emergencies over a period of time. And the economics of investment, as it was pointed out by the Satyan sir also and the Prasanna also. And now there are various issues. One thing is about having a very good OCT, which itself has a very good fundus photograph. So now no financial interest, but whatever OCT I have, that has a very good fundus photo image, and it gives up to 12 megapixels fundus photograph image, and that works well for me for studying the RNFL. So one option is having a OCT with good quality fundus photo machine that serves both purposes. Otherwise, someone is having a more retina focused practice, they can have ultra wide fundus photography machine also. Now, adding routine fundus photo cost to the patient's routine OPD charges makes the break-even investment easily achievable. Because as Prasanna was also pointing out, if we add just a small cost to our routine OPDs, maybe say 100, 200 rupees per OPD cost, and that we go on accumulating the number of volume that we see in the OPD, number of diabetics, number of the patients who will require routine fundus photography. In fact, all disc suspect, all glaucoma patients, everyone undergoes fundus photography in my clinic. So that how then if we go on adding so many fundus photographs per day, the break-even cost for investment is easily achievable in 1 year, 1.5 years, and whatever life machine has, each machine like 6 to 8 years, the machine will be profitable in long run. So why documentation with fundus photograph? Because it is worth in the current medical legal era, good for documentation, good for patient counseling, good in medical legal era, and good for serial follow-up. Because I think the next talk is with that only, how to have a serial follow-up with the fundus photograph. So good quality fundus photograph along with good electronic medical record system goes in a long way in streamlining the OPD, patient care, and the record retrieval also. So this is the best way forward for the high quality clinical care, in my opinions. Yes. Thank you.